Alright, so this video has more rules from the ALBOP. We're on paternal sterile therapy, so those types of pharmacists. They register and renew on even years. Certification and registration is required. Mandatory certification course, minimum of 5 contact hours, and pass a written exam for certification. Supervising pharmacists must verify registration and certification. ALBOP, of course, has complied with the USB guidelines. For nuclear pharmacy, and you typically will have a question on these hours, and I'll get to them, but there's a minimum of 2 hours of CE related to nuclear pharmacy for recertification. Your general requirements: you supervise only one nuclear pharmacy. Records of acquisition of inventory, distribution, and disposal. Dispense only when written prescription is ordered. The receipt of the order should have the time of calibration of the equipment, the name of the procedure, initials for persons dispensing, all of your typical things, name of patient required if it's a blood product. Some labeling requirements: so it has to have the radiation symbol, caution, radioactive material, the name of the procedure, the prescription number and lot number, the radionuclide and chemical form, the amount of radioactivity, calibration date and time, expiration date and time, volume dispensed if liquid, number of items or weight, number of ampules or vials, molybdenum 99 content to USB limits, name of patient or physician's use only. Immediate inner container, so this should have the radiation symbol, caution, radioactive material, the radionuclide, the chemical form, name of the procedure, prescription number. Now, some requirements for safe equipments though: you need the fume hood, the shielded container drawing section, the dose calibrator, well stimulated counter, a rate meter, molecular survey meter, refrigerator, microscope, hemocytometer, leaded glass syringe and vial shields, personal radiation detection devices, storage container for waste materials and volt supplies. You need syringes and vials, disposable gloves and protective lab coats, supplies for aseptic techniques, supplies for a thin layer of chromatography, lead transport shields, DOT type 7A transport containers. Now, for radio nuclear pharmacy, this is probably what you really need to know here is the training qualifications. 200 hours of classroom and laboratory training. This is radiation biology, chemistry, math, physics, protection. 500 hours of on-the-job training. So 200 hours of classroom, 500 hours of job training, 700 additional hours with the hours you need from an intern. Probably not relevant, but that's 1,500 plus the number I just forgot, 700, so 1,200. But patient counseling is very similar to the OBRA. So Alabama Board of Pharmacy, you must be offer for all new prescriptions or refills when appropriate. Distribute prescription with a number to reach the pharmacist for counseling. The Code of Professional Conduct, we're on 2.22. Professional manner at all times. Any violations with evidence can lead to discipline. And that they can word that in several ways, but I'll read it again. Professional manner at all times from Alabama Board of Pharmacy. Any violations with evidence, so pictures of you doing something, can lead to discipline. Cannot offer to participate in financial benefits. So for drug manufacturers, distributors, repackaging, outsourcing pharmacy section. Wholesale distributors, all involved in business of distributing drugs to agencies permitted to sell drugs. Something exempt here is the charitable drug donations for 340B. So a pharmacy can do charitable drug donations, and they would not have to be a wholesale distributor. 340B. Some record keeping, it's the same as other entities for your manufacturers. So some notes: chargeback records are to be kept separately. High or unusual volume purchases should be reported to the ALBOP. So the emergency prescription refills. So the patient ran out on Friday, they need an emergency. So only refills on file with on-file prescriptions for C4 and C5 or legend drugs. Up to a 72-hour supply, not a C2 or a C3. The MD has to be notified within 72 hours in writing, orally. Your patient consultation areas. So the OBRA 90 actually requires patient consultation area, and it has to be private to sound/view and not by a checkout per Alabama. It has to be large enough to accommodate participants per Alabama. devoted to enhanced patient outcomes. So definitely don't put your room in a storage area or somewhere just uncomfortable. Accessible by patient outside the pharmacy, so they shouldn't have to go through the pharmacy to get to it. In Alabama, the temporary absence of a pharmacist during a break or meal period, so your breaks are limited to 30 minutes within the facility. You can leave without closing or without requiring interns or techs to leave, and you have to know your controlled substances are secure. You can even close it if you deem it necessarily. And you must have a written policy of the procedures, and only check prescriptions that don't require consult may be given to patients. Your central prescription filling, 2.3. So a patient brings in a prescription, dispensing pharmacy sends fill request to filling pharmacy, prescription is filled and sent to a dispensing pharmacy sells to a patient. Central fill and refills are allowed as long as they have the same owner, or if they have a written agreement of services and responsibilities, have same or sufficient electronic systems needed to process the prescription or the drug, agreements maintained by both pharmacies, has info on all PharmD and techs involved and is reviewed yearly for quality improvement, have all equipment needed for proper protection, shipment, and storage of the drugs. Also, prescriptions must be returned to the dispensing pharmacy's inventory. No C2s, no C1s of course. Pharmacy must give a one-time notification to patients that their prescription may be outsourced. Outsourcing pharmacy's name, written to individual or sign posted in pharmacy is fine. For the labels, unique ID of filling pharmacy, so filled by X pharmacy for your pharmacy. Name and address of dispensing pharmacy. Any normal requirements on the label. So this has your normal prescription requirements except the filled by X pharmacy for the pharmacy you're at now, and the name and address of the dispensing pharmacy. X pharmacy. So for record keeping, you have to have a receipt of the prescription delivery, including the person who accepted it. If you're the dispensing pharmacy, the filling pharmacy also should track, the method of delivery. The daily operation hours. So a minimum of 20 hours a week for a pharmacy, less than 20 if ALBOP approves. And you have to have a sign showing your hours, no less than 1-inch letters. And just say again, your dispensing pharmacy has the date, fill request, and has to have the receipt of the prescription delivery, including the person who accepted it. So the place who accepted it keeps a receipt of who accepted it in their pharmacy. The filling pharmacy has track of the method of delivery. So prescriptions by electronic means. This method can include the electronic signature process, date and timestamps, transmitting system ID, prescriber internal sender ID, pharmacy internal receiver ID. An e-signature is not valid for a controlled substance unless the practitioner and pharmacy are approved by the DEA. I guess that's a given, but just make sure you read your questions on the MPJE. Continuing education for pharmacists, of course, 15 hours a year, 3 of those being live, so that's 30 hours total, and it's done on even years. They have to be ACPE approved hours, and you have to maintain these records for 2 years with CPE monitor. And you can carry over 12 years, but none of your live. You can carry over your live, but it won't count as live when they're carried over. For licensure of graduates of foreign schools of pharmacy, you must provide a foreign pharmacy graduate equivalence committee certification in addition to complying with all requirements of Alabama Pharmacy Practice Act relating to licensure. Must effectively communicate in English. For non-hospital pharmacy offsite order entry, which is not working at home, but at first I read it and thought that. So non-hospital pharmacy offsite order entry. So offsite order entry pharmacy. Non-hospital pharmacy must, with valid permit to process legend and control prescriptions, remotely access another pharmacy's electronic database from outside the pharmacy in order to process prescription drug orders. Does not include dispensing. Includes interpreting, clarifying drug orders, data entry and transfers, performing drug utilization reviews, drug regimen reviews, DURs, obtaining refill and substitution authorizations, performing therapeutic interventions, providing clinical prescription counseling. You can see how this could be very beneficial for large chains with very busy pharmacies. So drug regimen review, your DUR, Evaluates a prescription drug orders and patient profile records for known allergies, rational therapy contraindications, reasonable dose and route of administrations, reasonable directions for use, duplicates of therapy, drug-drug interactions, drug-food interactions, proper utilization including overutilization or underutilization. So something that of note that's not in there is, you're searching for ways for them to get cheaper therapy or anything like that. But so it's a drug utilization review. We're still talking about the offsite pharmacies, must request board approval for offsite entry, minimum of 30 days prior to a board meeting. You must have the same owner as a pharmacy or have the written agreement of service responsibilities, common electronic systems, need to process prescriptions, agreement maintained by both pharmacies, info of all the texts, Pharm Ds, reviewed annually for quality improvement. You do notify your patients, maintain appropriate records at each pharmacy. Now, there are some acts prohibited by offsite order entry pharmacy. So processing a prescription outside of physical premises of the pharmacy. So this may be a pharmacy that doesn't see people, but it's still a pharmacy. There's no working from home, no working from call centers, and no working from a portable or handheld computers. Some non-disciplinary penalty for late renewal of license or permits, or the registration or certification. So after December 31st and no later than January 31st, $1,000 for pharmacy permit or pharmacist license, $250 for tech registration, $500 for pharmacy or pharmacist controlled substance permit. So try not to be late on these things. Pharmacy services permit. Call centers, offsite service providers must have a supervising pharmacist on site. No Pharm D to tech ratio at a pharmacy call center. Return or destruction of drugs by pharmacies. You must register with the DEA if dealing with controls within 10 days of receipt of the control medications. And I sound like I had more, but I don't. So that has been the end of the Alabama pharmacy. Next, I'm going to go to the controlled substance for federal and then for Alabama. And then you should be ready for your MPJE.